Yes, very timely. Big Society, Small State. We would have all heard David Cameron's sterling speech yesterday. Your country needs you, which is interesting actually, because back in 1880, Millicent Fawcett, our founder, actually said, "Women, your country needs you. You must stand up as citizens." Interestingly, even if your claim to be a citizen is not recognised, and I think that's really, really important. So, over 100 years ago, what she was actually talking about was, even if you're not recognised as equal citizens, for our society to function, women must stand up and take part. So, big society, small state, how will women fare? Well, overall, I have to say, it's not looking good. First of all, we pride ourselves on being very evidence-based. We don't just like to shout without knowing what we're talking about. And if you look across the globe, and if you look at all research, where women have greater levels of equality, where there has been improvement in women's equality, you have had greater state intervention. It's been absolutely critical. Whether it's legislation around equal pay, whether it's provision of childcare services, etc., the role of the state is absolutely critical. The state is a bulwark against basically a huge market capital economy that is built on not just inequality between men and women, but between many people. So the state does have a critical role there. The state, one way of looking at it, is the state kind of represents our collective democratic will. So even if you have a good society that does believe in equality, the state should do our bidding. We elect the government. It should represent the fact we want to live in an equal society. And I think we have to question whether it has been doing that job for some time, and certainly whether or not it's doing it now. But let's be clear, there is a clear ideological drive, move afoot going on here from the new coalition government to shrink the state. And I think as women's or equality campaigners, whilst it's really important we talk the talk, we understand the new political language, we understand where the coalition government is coming from, we must be truthful and honest. There is an ideological drive to shrink the state. It is not just driven by a need to cut the deficit, it is driven by a belief that there should be less state intervention, and we need to be honest about that. So yes, we have very austere times, yes, we need to cut the deficit, but there are clear choices, and we must not forget that. Whether you are a local authority, a regional authority, or a national government, there are choices to be made about how that deficit is cut. And we know that the overall approach of the current coalition government is what's called an 80-20 split. 80% of deficit to be cut from reducing spending in public services, and 20% to be met by a reduction, by increases in taxation. That's a choice. And it's a choice that any evidence will tell you will impact disproportionately on women and will worsen women's inequality. But I would also say, and I'll come back to this later, that in cutting the deficit this way, it's Fawcett's belief that this coalition government is using the deficit cutting agenda as a cover for a wider socially progressive agenda that would see women back in the role of the 1950s, and we are going to be honest and we will continue to say that. So there are two things. There are two things afoot. So, to summarise, triple jeopardy. I've got this up here, I'm going to walk around so I'm not in your way. I can email copies of this later because it's got some interesting facts and stats if you're working with your local authorities. So the triple jeopardy, what are we facing? Cuts to jobs. Women's jobs and where women are working. Women's jobs are obviously hugely important for women in terms of our economic inequality, but also cuts to services and benefits that women rely on far more. And finally, women are likely to fill the gaps. And we'll come back to this later, but who do you think is going to pick up the elder care, the social care, the child care, the adult care, who do you think is the big society? Not only women. I've worked, one of my first mentors in community development was a man, but I would say that most of my initial training was in the grassroots of suburbs, some of the most poorest communities in the country, and I can tell you who the big society was there, and it was women. It was women working very hard on the ground in their communities. So triple jeopardy. So let's just cuts to jobs. Oh, that's very green. Sorry. Sorry about that, I'll read it anyway. So the Office of Budget Responsibility estimates, just to start with, 600,000 jobs are going to be lost in the public sector. I would have thought it's likely to be more than that. So we know 65% of public sector workers are women. Within that, 73% of local government workers, 77% of the National Health Service, 87% of primary school teachers. And we're looking at a particular impact of women who are already earning very low wages or on part-time wages. The pay gap, if you are a part-time woman working part-time, between women and men is 39%. Still, 40 years after the Equal Pay Act, 39%. So when they say we're not going to get rid of frontline services, it's the part-time, back of office workers, it's the temporary workers, often the first to go, often the woman who's working part-time and also trying to support a family. Cuts to services, social care services, children, elderly, services for disabled. Children's services, we've already seen the cuts happening there. Support for teenage mothers, support for pregnant women. We've been working with the Maternity Alliance. They're estimating 40,000 midwifery places are being lost as we speak in terms of the reorganisation. And domestic violence. I noticed you've got somebody from Women's Aid speaking later. And we've been talking to our sisters in Canada, by the way. And the reason we've been doing that is, I don't know if you've noticed, the coalition government's been talking about using Canada as an example of how to cut the deficit properly. So we picked up the phone and spoke to Canada, and spoke to the women's organisations in Canada, and what did we find? Massive cuts to the women's sector there. The women's sector, and particularly the violence against women's sector, was decimated. And history and evidence will tell you that in times of austerity, it's often the equality programmes and the services and the interventions that go first, particularly at the local level, because we haven't embedded them as yet. Cuts to benefits, and your chair touched on this earlier. So we were starting off with a situation where tax credits already, for most women, made up a fifth of women's income as opposed to only a tenth of men's. And this is not because, as I think I heard the Daily Express say the other day, women are all welfare scroungers. It's because of the way our society is structured. So, you know, women do have children, and even those who don't have children, you know, often have greater care and responsibilities, face greater discrimination at work. So I'll come to child benefit, as was mentioned earlier, a bit more later. Reduction in entitlement to childcare tax credits, lone parents, housing benefit. Far more women rely on that than men. 70% of housing benefit is paid to women. Uprating of the consumer price index, and maternity payments just gone. Slashed in the last emergency budget. I'm going to try and cheer you up later. Sorry. Good morning. I just thought. But I think this next one, women filling the gaps, which I talked about earlier, is a very interesting one, because all these cuts are based on, I think, a really worrying assumption. And I have to say that that assumption was slightly there in the last government as well. This is certainly not just a coalition government thing. We looked at all the manifestos before the last election. So there is this aggressive ideology that women are going to fill the gaps. So we already do far more unpaid work than men. In fact, it's calculated 89 billion a year in free care is provided by women. That's the same cost as running the NHS. It's just part of our society, the assumption that women do that for free. So when you want to talk about the big society, women have been doing that for many, many years. Women doing 3/4 of childcare during the week and 3/4 of recipients of carers allowance are women. I think 89% of carers are still women. Now, I'm not saying that's necessarily a right thing, and I think over time all of us would like there to be a greater gender balance between who's doing the care between men and women. But that is the reality now, and if you're a government, you make policy based on the reality of people's lives.